Is it easy to increase sperm motility or not? Because many patients are often in a dilemma about whether their sperm count is good but unsure if motility can be improved or not. Look, basically increasing sperm motility is somewhat of a task for any doctor. It's not a clear why or for what reason motility is poor, which means we often has to study the behavior and condition of the sperm in depth. So, it takes some time to adjust, think and understand whether the medication we prescribed is helping to improve motility or not. If it doesn't improve, then another medication is tried to see if it makes a difference. Understand the correct cause and selecting the right treatment method is very important for improving sperm motility. In this video, we will also talk about overall gut health because the health of stomach has a deep impact on sperm motility. So today we will talk about your motility, but before, let's look at the report to see whether motility can be improved or not. In the reports, you will see the before and after condition of the sperm, which will show you how much progress has been made with the treatment. So, this is a before and after report. You can see the difference in motility between the two. I am also underlining the part where you can see for yourself how much improvement has occurred in a sperm movement. Let's first talk about how motility actually is. Generally, people understand motility is a different way. Sometimes they focus on the structure, sometimes on sperm count or a concentration, or even on the dead sperm count. So, let me start by explaining sperm motility. Sperm motility is basically the movement of your sperm. Now, what does the movement entails? It's similar to how a fish swims in an aquarium. As you might have seen, just like a fish swims or moves, our sperm also swims in a liquid substance that is produced by our system or the prostate gland, which we can call by semen. Sperm travel through semen and then through the vaginal fluid to penetrate the egg. Now, the way they move isn't exactly like a fish. It's slightly different. They move by spinning their tails in a spiral motion. This spiral motion, where the tail spins around the propeller forward, is what we call motility. The better they can spin, the more structurally fit they are, and this movement is what we basically refer to as motility. Now, motility is divided into two parts, basically three parts, but I am just explaining about the two parts. This will help you understand why the movement of two sperm can be different. First, progressive motility. This is the type of motility where the sperm moves rapidly in a straight direction, meaning the sperm has the ability to move quickly in the right direction. This increases the chances of a sperm reaching towards the egg. Now, second, non-progressive motility. This is a condition where the sperm moves around but doesn't progress in a straight direction, meaning the sperm has a movement but it fails to reach the egg. So, you can understand why motility is important. Because the sperm's ability to swim in a right direction in order to reach the egg and fertilize it depends on a motility. If sperm motility is low, the chances of fertilization also decrease. Now, let's talk about how motility can be affected. There are many reasons why motility can be compromised. If I have a low sperm count and a high number of dead sperm, my motility will be affected. If my sperm's morphology or a structure isn't right, my motility will be affected. If the sperm doesn't get enough movement in the structure, our motility will be compromised. So, there are many factors that can affect motility. Now, if we start from beginning, meaning from where it starts, we need to consider the spermatogenesis cycle. The spermatogenesis cycle essentially provides us with the mature sperm, which we refer to as a sperm. If the sperm is being produced correctly, is well prepared, physically fit, and has all necessary activities, then our motility will be perfect. But if there is a problem in a sperm production process itself, it will lead to complications. Consider this: if my production line isn't functioning properly, then the product coming out of the production line won't be up to the standard, whether it's a good or a bad, because there is a no stopping process. Similarly, when there is an issue in the production line, the product, you mean to say sperm, might be of poor quality, leading to a poor motility. Now, how can we correct this spermatogenesis process? Let's talk about how we can maintain good motility. It's simple to understand. There are three essential nutrients required for sperm production: protein, selenium, and zinc. These three are crucial, and you can gather them through nutritional food or through supplements. If you have these nutrients in sufficient amount, the process will be maintained correctly. Let's imagine spermatogenesis as a shoe manufacturing company. If the company production line is missing element, like the electricity isn't reaching a sewing machine, it will show down or stop the production process. The same thing happens with your system. If an essential element for the process isn't available, it will slow down or hinder the process, resulting in poor motility. Therefore, we need to add element like zinc, selenium, or a protein to our diet to improve motility. Now, let's talk about the gut health, because we have seen that most of the patients with disturbed motility, their gut health is also compromised. How can we improve gut health? Ask yourself these questions and note them down. After watching this video, ask yourself questions like, do you need to go the restroom immediately after eating? First. Second question, is your stool sticky or is it blackish in color? Third question, is your motion very sticky after going to the restroom, or is there any white discharge after your motion? If any of these things are happening to you, understand that your gut might be the reason for your poor motility, because your intake isn't being assimilated properly and you are not getting the nutrients you need, which is affecting your motility. Answer this question yourself, and if you are not satisfied, consult my team at the number given below. Talk to them and discuss your issues. If you found this video helpful or liked it, please like, share, and press the bell icon. I will see you in the next video. Until then, Tata, see you and take care.